How does gut health tie into sexual performance? Let's break it down. I might need your insight here, Rina, since sexual function is more your specialty. Let's start with something straightforward. There are well-known risk factors for erectile dysfunction, high blood pressure, high cholesterol, and diabetes. For each of these conditions, strong evidence shows that gut health influences them. Fiber, for example, has been proven in controlled studies to improve blood pressure, cholesterol levels, and glucose regulation. That's because gut health is directly linked to our metabolic health. Conditions like hypertension, high lipids, and poor blood sugar control often signal a metabolic imbalance, something that can be improved by restoring gut function. Another major contributor to erectile dysfunction is inflammation, which can interfere with healthy blood flow. And this is where the gut's role is huge. Around 70% of our immune system resides in the gut. When this system becomes activated, it releases cytokines that trigger inflammation throughout the body. Research clearly shows that inflammation is associated with erectile problems. Since the pandemic began, have you seen an increase in erectile dysfunction? I have. A big part of it is reduced movement. People are sitting more, working from home, barely walking or moving, which affects pelvic floor tension and circulation to the penis. And for those who had COVID, the inflammation that comes with it often impacts both erectile function and gut health, showing the connection in real time for some individuals. Anxiety and stress also play a role. This goes back to the balance between the sympathetic and parasympathetic nervous systems. To increase blood flow to the genitals, the parasympathetic system needs to be active. As the old med school saying goes, parasympathetic for erection, sympathetic for ejaculation. Anxiety and stress push the body towards sympathetic dominance, which can interfere with sexual function. And through the brain-gut axis, gut health can influence mood and stress regulation. Now, let's shift to the gut microbiome itself. Testosterone clearly influences sexual function. In women, there are specific gut microbes connected to estrogen, known as the estrogen. We don't yet have a similar named category for men's microbiome, but researchers have identified microbes linked to testosterone activity. One example is Clostridium SC in dens. If we examined the gut microbiome of 100 men with erectile dysfunction, on average, we'd find reduced gut diversity compared to men without erectile issues. It's not as simple as microbes control erections, but overall health is interconnected. When we improve gut health, we elevate multiple systems, sexual health included. Many men are curious about boosting testosterone. What supplements should they take? Zinc is commonly recommended, and interestingly, it also helps repair the gut lining. When I was doing my internal medicine residency at Northwestern, patients with hepatic encephalopathy were treated using two main components, zinc and antibiotics. Zinc plays a wide-ranging role in the body, including restoring the gut. Barrier didn't actually understand it at the time. But years later, once I began studying the gut microbiome in depth, I realized that the treatments we were giving were actually rebuilding and supporting a healthier microbiome. That's what was helping prevent those patients from developing hepatic encephalopathy. In other words, that condition is heavily linked to gut dysfunction. Zinc is one example of a useful mineral. I've also heard people mention antioxidants, like quercetin, a polyphenol, and works like a prebiotic, meaning it supports beneficial gut bacteria. The research isn't overwhelmingly strong yet, but if we're talking minerals, that may matter. Zinc, magnesium, and boron are typically mentioned. Regarding supplements like Tongkat Ali and others, the evidence is still limited. I don't know enough about some of them in relation to their effects on the microbiome, and I haven't seen solid studies confirming clear benefits. The reality is that supplements rarely have strong universal data behind them. It depends heavily on the individual. If someone is deficient in zinc, magnesium, or boron, supplementation could genuinely help. If they're not deficient, then there's probably little to no benefit. Testing is useful for that, to want to look at how you feel and what your testosterone levels are doing in response. Now, to another gut-related topic, alcohol, and, while we're at it, marijuana and other substances. I'm sorry in advance because this might spoil some people's enjoyment. The research I've seen strongly suggests alcohol harms the microbiome. One thing is absolutely clear: if you drink enough to get a hangover, you've caused measurable damage to your gut bacteria. Where the science is less defined is at the lower end, say 1 drink, maybe 2. No hangover, no next day symptoms. That area is much harder to judge clearly. And there's more debate about whether any meaningful microbiome harm is happening at that light consumption level. There was a study I read a few years ago that really shifted how I think about alcohol, and after seeing the results, I personally cut back a lot. Here's what the researchers did. They had a group of participants drink vodka at a fairly high level and measured both their blood alcohol concentration, and their blood levels of lipopolysaccharides. LPSR, fragments from gut bacteria. They're normally contained within the gut and shouldn't be entering the bloodstream lest the gut lining has been compromised. What they found was striking. The graph showing alcohol levels and the graph showing LPS levels were essentially identical. When alcohol spiked, LPS spiked. When alcohol dropped, LPS dropped. And the LPs didn't fully settle until the alcohol levels returned to baseline. So while this doesn't definitively answer whether one drink is harmful, the fact that any measurable alcohol in the bloodstream corresponded with an increase in LPS suggests alcohol causes some degree of gut barrier injury at virtually all levels. And honestly, just from lived experience, if I have even a single drink early in the afternoon, I feel sluggish afterward. That alone tells me something is off. Plus, there's strong evidence that alcohol increases cancer risk and even one drink disrupts REM sleep. So there are multiple layers of concern now. As alcohol has become less trendy, marijuana has surged in popularity. I have major reservations about this too, not just for cognitive effects. Historically, we'd joke and call someone a pothead, but that stereotype turns out to have biological backing. Long-term heavy cannabis use has been associated with reductions in brain volume. And from a GI perspective, there's a condition known as cannabinoid hyperemesis syndrome. Here's what it looks like. A young adult comes in and says, "I'm vomiting constantly. What's happening?" I ask them one simple question. Do you crave really hot showers? If they say yes and that they can stay in a hot shower for an hour because it makes them feel better, that's a major sign. Often they'll be hesitant to admit their marijuana frequency, especially if family is present. But once we uncover it, the pattern becomes clear. Chronic marijuana use can trigger ongoing nausea and vomiting cycles. The worst part is, they temporarily feel relief when they use cannabis again, which makes quitting difficult and requires both education and sometimes medication. Years ago, this condition was rare. Mentioning it during residency made you sound impressive. Now it's becoming common. Switching topics, let's talk about bathroom habits. Specifically, lingering on the toilet. The main issue is what prolonged sitting does to the pelvic floor and to hemorrhoids. Hemorrhoids are clusters of venous tissue. Think of them like built-in cushioning. Normally they're not swollen, but when you sit and prepare to have a bowel movement, they fill with blood. The longer you sit, the longer they remain engorged, and the harder it becomes for the blood to drain afterward. This increases the likelihood of developing hemorrhoids, and they're extremely common by age 50. Roughly half of people have experienced them. I had no idea hemorrhoid problems were that common, and most people who develop them definitely wish they hadn't. The typical assumption is that hemorrhoids only come from constipation, and yes, straining absolutely makes flare-ups more likely. But really, any change in bowel habits including diarrhea can trigger them, and simply sitting on the toilet for too long is a big part of the problem. My general advice is, aim for no more than 5 minutes. Don't strain. Don't force anything, but also, don't sit there scrolling on your phone. People often treat the bathroom like a mini escape. Room parents especially, but long toilet sessions are rough on rectal blood flow. Ideally, 5 minutes is best, but definitely not more than 10. Now, let's talk hygiene. Bidet versus toilet paper. I am firmly pro bidet. A bidet is genuinely one of the best wellness purchases someone can make, and it's not even expensive anymore. You can get a decent one online at a very reasonable price. It's a far more effective and gentle way to clean the area. Many people use sanitary wipes, but I strongly advise against that. The anal area has a natural level of moisture and oils that protect the skin. Wipes strip that moisture and disrupt that protective barrier. This is actually the leading cause of pruritus, ani, or anal itching. It's a similar issue that happens in women. When the vulva is overwashed or wiped excessively, it causes irritation, dryness, sensitivity, and discomfort. Some women even come in thinking they have a UTI, when in reality it's the result of overcleaning. If hemorrhoids are present, they can also contribute to itching, and sometimes they require treatment. But in many cases, the core issue is simply overwashing and skin irritation rather than infection. A surprisingly large number of people improve simply by giving that area a break. Stop using wipes, perfumes, soaps, or creams that dry out the skin, and lower the temperature of your showers. Just rinsing with plain water is completely hygienic. Before we wrap up, I want to touch on the topic of anal sex. It's definitely become more common and more openly discussed in both straight and gay relationships. So from a gastro perspective, understanding the sensitivity of the tissues in that area, what guidance would I offer for staying safe and avoiding injury? First, it's essential to do this with a partner you trust and can communicate openly with. You should be able to speak up, slow down, and stop at any point. There's no need to rush. When I say take it slow, I don't just mean slow during penetration. I mean gradually building up to it over time. That may include foreplay, external stimulation, and using small toys at first, gradually increasing size as the body adjusts. The tissues involved, the skin and the muscle inside both, need time to adapt. Slowly introducing gentle stretching is similar to conditioning any part of the body. Think of how skin on the feet gets tougher as someone spends more time walking barefoot. The area becomes accustomed to pressure gradually when you eventually move into anal penetration. The key principles are: go slow, use lots of lubricant, relax. And if you're on the receiving end, focus on breathing to release tension afterward. I still recommend water cleaning, like with a bidet rather than wipes. And if there's bleeding afterward, that suggests irritation or microtrauma. It could be a stressed hemorrhoid, an irritated inner tissue, or a small tear known as a fissure. Usually, the solution is rest, increased fiber intake, and a stool softener, so bowel movements remain gentle. Give the area about 5 days to recover. As for stool softeners, there are a few good options. Something basic like Kolache works well because it softens without triggering diarrhea, which you absolutely don't want in this situation. If you've used magnesium before, I'm a big supporter of magnesium forms that help with bowel movements, specifically magnesium oxide, citrate, or sulfate. Glycinate and threonate are not for digestion. They're mainly for sleep or other benefits.